Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
in obsessive compulsive disorder, which is not given. In obsessive compulsive disorder, we will give clomipramine, haloperidol. Sertraline is not given. Is given. Anti-epileptics like carbamazepine are not given in obsessive compulsive disorder. If you see, in obsessive compulsive disorder, according to American Psychiatric Association, first you will give the first line drugs are either SSRIs, selective serotonin reuptake inhibitors, or clomipramine. Okay, if these are mainly used, you can also augment these with haloperidol or other drugs. First line we give SSRIs or clomipramine. But if the patient does not respond to these drugs, if there is no response on giving selective serotonin reuptake inhibitors and clomipramine, then we can give antipsychotics. In the antipsychotics, we can give drugs like haloperidol can be given to the patient, risperidone can be given, and we can also give other drugs like quetiapine and olanzapine are also given in the patient. So these are mainly used, and this carbamazepine is an anti-epileptic, and this is rarely used in the treatment of obsessive compulsive disorder.
thank you and thank you for watching.